So medical genetics is the branch of genetics that deals with what? The diagnosis and what? Management of hereditary disorders. Good. Let's take for example your sickle cell anemia. We have, when we talk about blood group, how many blood group do we have? Blood group. I'll catch them now. Number 1. Blood group what? Blood group. Blood group. And blood group what? Okay, we'll come back to this. This is blood group, right? Now, talking about genotype. How many genotypes, common genotypes do we have? It says what? Okay, that is 5. 3. Name them. AA, AB, AS, SS. Good. Now, there are other ones, but these are the 3 common ones, right? Good. Now, AA, we said they are what? They are normal, right? Normal human beings like me. AS, they are what? They are carriers, right? Who said they are normal? So they mean you are partial number. What is it? Alright, AS, we said they are carriers, right? Now look at the reason why we call them carriers. Please, as I always say, anything you don't understand, call me back. Because before you know we are done with this topic, I don't like giving too much notes. Get it here. Now, AS, we said they are carriers because look at this S. This is sickle cell trait, right? Remember in verse 202. Okay, you did not remember, sorry. Now, we know that genes are always in pairs, right? 2, and 1 is called what? An allele, right? Allele. Alternate form of a trait is an allele, is it not? So one of these is an allele, this is another allele, is it not? This is an allele, this is an allele. So this S here is an allele for what? Sickle cell. But sickle cell anemia is a homozygous recessive trait disease. That is, for you to express it, you must have 2 of them. Do you get? That's why here we call them what? Sicklers. SS, we call them sicklers. Anyone here? I'll say hi. No, they can manage it now, so don't be afraid. Can manage it now. Alright, so SS. And this SS here is a hereditary disease. Remember, medical genetics is a branch of genetics that deals with what? Diagnosis and management of hereditary disease. Good. Now, you were told, me, I am AA, or let's assume the person is AS, not me. And you say you fall in love, and you want to get married, and the person is not AS. You say love is blind. You will blindly get SS too, because the love is blind. You know, if you are AS and you're AS, you'll be advised not to marry, right? Because if you cross this, this will give us what? 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 So there's a chance of getting an SS, right? Some persons will say they want to be wise, that, okay, SS is coming at the 4th one, I'll just get 3 children. Please, unlike what we used to know before, you know, when I was in JS3, they taught us this topic, and I wanted to show my dad that his school fees was not wasting. So what I did was, I didn't know my genotype. I told him, I told my dad, just tell me your own genotype. Tell me your wife's genotype, and I will tell you the genotype of your first 4 children. It doesn't work that way. It doesn't mean the first son or the first child is AA. No. It doesn't mean this is the second child's own. It doesn't mean this is the third child's own. These are just probabilities. The first child might even be SS. This thing shows that your children, the genotype of your children will fall within this. Do you understand? Now, medical genetics is a branch of genetics that deals with what? Diagnosis and management of what? Hereditary disorders. Do you understand that? For example, sickle cell anemia and the rest. Now, what are the reasons why some persons have genetic disorder? What leads to hereditary disorders? I gave you 3 there, which we are going to look at. We said number 1 is what? Polymorphism. Number 2 is what? Very dangerous. Mutation. And number 3 is what? chromosomal defects. So we are going to look at these three things, and according to this course, normally it's arranged differently, but we are going to take them together. And please, anything you don't understand, you will see it in the exam. If it's not formal, I will not bother doing it. Let's look at polymorphism, subheading. Polymorphism. Right. Polymorphism is the variation. Polymorphism is a variation between normally healthy individuals. Polymorphism is a variation between normally healthy individuals. Between normally healthy individuals. Full stop. This concept is especially important. This concept is especially important in blood transfusion. This concept is especially important in blood transfusion and organ transplant. Full stop. An example of polymorphism is seen. An example of polymorphism is seen in the ABO blood grouping system. An example of polymorphism is seen in the ABO blood grouping system. Are we there? Take that as subheading. ABO blood grouping system. ABO blood grouping system. Right. The ABO blood grouping system. The ABO blood grouping system is one that involves the classification. Of the human blood into 4 groups. Alright, so I said somebody of blood group O, there's no antigen on the red blood cell, right? Now another thing we need to note is antibodies that are, we say antibodies fight against antigens, is it not? Now one thing we need to note about antibodies is they are specific in action. Please understand this. If you understand what I'm saying here, this one will be Jara. Antibodies are specific in action, meaning antibody A will only fight against antigen what? A, because they are specific. Antibody A will only fight against antigen A. Antibody B will only fight against what? Antigen what? Antigen B, right? You are not following. I said, please, anywhere you are lost, call me back. It will be better you understand one thing than for me to say I'm done and nothing enter. It will be a waste of time. Now, antibodies are specific in action. Antibodies fight against antigen, right? Now, let's take antibodies to be a fighter. Now, the antibodies, since they are specific in action, antibody A can only fight against antigen what? A, right? Antibody B can only fight against antigen B. Now, good. Can antibody A fight against antigen B? No, right? They are specific in action. So antibody B cannot fight against antigen A. Do we get? You get it now. Now, if you are of blood group A, that is you have antigen A, right? Can you have antibody A at the same time? The antibody A will just inside you. The antibody A will start fighting against the antigen A. Do you get? But can you have antibody B? Because antibody B cannot fight against antigen A, so you can have antibody B, no problem. They will coexist because it cannot fight against antigen A. Do you understand? If you don't understand, I will explain again. Oh, because if you don't get this one, forget about this one. Seriously. So this one here, somebody of blood group B, what antigen does that person have? Somebody of blood group B, antigen what? Hey, excellent. Don't teach yourself today again. Antigen what? Antigen B. How? I mean, somebody of blood group B, what antigen? Antigen what? B. Who said A here? Who said A here? Antigen what? B, right? Good. Antigen B. Can this person have antibody B? Can he have antibody B? What antibody can he have here? Good. Because antibody A cannot fight against antigen B. It's impossible. Because antibodies are specific in action. Hope you are following. Nobody have your max number. If everybody understands and you don't understand, say I don't understand. I will take it again. Now, blood group AB. In blood group AB, what antigens do we have? Antigen A and antigen what? B. Good. What antibody does this person have? No antibody. Because if this person has antibody A will go and fight against antigen A. If this person has antibody B will go and fight against antigen B. So for peace to reign, they say, oh yeah, nobody should have antibody. Do we understand here? Now, somebody of blood group O, what antigen does that person have? Antigen A and what? Alright, good. So what antigen does this person have? No antigen, right? Good. No antigen. But what antibody can this person have? Child, no. Look at it again. No antibody here. No antigen here, right? What antibody can this person have? Why? A and B, right? This one is antibody A. Is there any antigen A to fight against? Peace will reign. This one is antibody B. Is there any antigen B to fight against? Good. Now we are going to apply this principle in blood transfusion. We are going to apply this principle in blood transfusion. Do you understand this? Yes, sir. Good. Now let's say this is our donor and these are recipients. You can put it anywhere. You can put donor here. You can put recipient here. Please don't cramp, because some of you can cramp plus minus. Like, understand what you are doing. Good. Donors are people that give out blood, right? And recipients are people that receive. Good. So these are the donors. They've taken their position already to donate blood. These are the recipients they are about to receive. You have to test your compatibility. For compatibility. In fact, when we go on, you see that it's not all O that can donate blood to all O. So it's not as O na general donor, you just carry O, you choke. No, it's not done like that. You see that when we talk about the rhesus factors. But now, look at this. Can somebody of blood group A donate blood to somebody of blood group A? Yes. Hey. Somebody of blood group A donate blood to somebody of blood group A? Yes. Where is Sam happen? Yes. Alright, you between. Alright, so let's see why. Let's look at this. Let's look at this way. I'll do only the first line. I'll give you the next three lines as your test, your CA. Yeah. Now let's look at here in the donor. Let's look at antigen. And here let's look at antibody. What antigen is found here? Antigen what? What antibody is found here? Antibody B, right? Can antibody B fight against antigen A? No, right? So since it cannot fight, can they receive blood? Do you get? I'll take it again. In the recipient, look at the antibody in the recipient, person where they receive blood. Is the antibody able to fight the antigen coming in? Because the blood you are bringing in now contains antigen on the red blood cell, right? And anything coming into your system, your body considers is foreign. Your body will want to react. So the antigen coming in now on the donor's red blood cell, is this recipient's antibody able to fight it. Now look at this. This is the recipient. We want to look at the antibodies on the recipient. And the donors, we want to look at the antigen found on the red blood cell. And here, if the donor is blood group A, what antigen is found here? Antigen A, right? Now let's look at the antibody in the recipient. What antibody is found here? Antibody. Can the antibody B here fight against antigen A? It cannot fight, right? So peace will reign. So we call it positive, so it can go. Do we get? If you don't understand, I'll take the next one. It's the same principle, right? So if you don't understand, look at the next one now. What antigen is found here? B, right? Antigen B. What antigen is found here? Antigen. What antibody is found here? Do you know how we got here as antibody B? You joined late. Now look at this. We said these are the blood groups. Blood group A, B, and O. Now the antigen on the red blood cell is what determines the blood group. So somebody of blood group A have antigen A. In fact, the name of the blood group is the antigen. Is it not? Somebody of blood group A, antigen A. Blood group B, antigen B. So blood group AB, antigen A and antigen B. Blood group O, no antigen. There's nothing like antigen O. And it means that there's no antigen. Good. Now, we said antibodies are specific in action, right? Meaning antibody A can only fight against what? Antigen A. Antibody B can only fight against antigen B, right? Good. Now, so if I put A here, can antibody A fight against antigen A? Yes, right? So you cannot have something that you know will fight against you. Do you get? But if you have antibody B now, no bagger. Antibody B cannot fight against antigen A. It's just like having antigen A and you are now producing antibody A. It's just like you have all this native dog, all this, how do you call it? All this dog that used to chop shit. And you now buy egg or fowl and put in the same place. They will fight. There will be war. So you cannot do that. Yeah, antibody B, antigen A cannot fight against this, right? Yeah, this one have antigen A and antigen B, double problem. So for peace to reign, if there is antibody A here, antibody A will go and fight against antigen A, right? If there is antibody B will go and fight against antigen B, right? So for peace to reign, there is no antibody here. But this one, I used to like this one. This one is antibody what? Antigen. What antigen is found here? No antigen, right? So since there is no antigen, this person can have both antibody A and antibody what? Antibody B, no problem. Good. Now back to this. What antigen do we have here? Antigen B, right? What antibody do we have here? Antibody B. Antigen B. Can antibody B fight against antigen B? Yes. So is it plus or minus? Do you understand? If you don't understand, next one now. What antigen do we have here? Antigen A and antigen B, right? Good. What antibody do we have here? Antibody what? Can antibody B fight against this antigen B? Plus or minus? Do you understand? If you don't understand what you are doing, let me see your hand. No, you are not changing A to B. Just understand that this antigen A, right? But antigen A, we have antibody B. Do you get? So it's the antibody we are looking at in this side. Do you understand? I'll recap with this one because it's the same principle. What antigen do we have here? Please feel free to ask your questions though. Even if everybody understands, feel free to ask your question. The only time I will not answer you is when you were not listening and you now call me back. Now, this is blood group O, right? What antigen do we have here? There is no antigen. There is no antigen, right? Good. Look at this one here. What antigen do we have here? Antigen A, right? The name of the blood group is the antigen. What antibody do we have here? Antibody B, right? Antibody B. But here there is no antigen. Nothing to fight against. Remember, antibody is fighting against antigen. But this one does not have any antigen. So whether we have antibody, anything here, it cannot fight against no antigen. Cannot fight against air. Do you get? Here there is no antigen. Here is antibody B. Antibody B cannot fight against no antigen. So plus or minus? Let me take this line and you take the other two for me. So I'll be sure you understand. If you don't understand, still follow. What antigen do we have here? Please, after doing this one, and any of you fail this other two, forget about your CA. Nobody should meet me after now for CA. Because this two is your CA. Now, antigen, this blood group A have antigen what? A, right? Good. What antigen do we have here? What antigen do we have here? Antigen. Antigen. Oh, antigen B, right? Remember, the antigen is the blood group. So this antigen B, right? What antigen do we have here? A, right? Don't give up, please. So what antibody do we have here? Antibody. Can antibody A fight against antigen A? Plus or minus? Look at this one. What antibody do we have here? Thank you. What antigen do we have here? B, right? What antibody do we have here? Can antibody A fight against antigen A? Plus or minus? What antigen do we have here? Antigen A and antigen. What antibody do we have here? Can antibody A go and fight against antigen A? Plus or minus? What antigen do we have here? No antigen. Yeah, what antibody do we have? Can antibody A fight against air? So plus or minus? Do you understand? Complete this other two for me as your test. I'm giving you 1 minute for that. Just 1 minute. Don't cram plus minus. Minus plus. If you are done, just call my attention. If you are done, just call my attention. No, relax. No be exam, no copy. Relax. This one confidence in which was doing. It's in your job. Someone have gotten all. Meet me for 10 marks for finishing fast. Nice one. What's happening? You don't understand? Oh yeah, do something. Anime, I'm waiting for you. Mechala. Sawa. Good. Nice one. Check this one very well. Check this last line very well. In fact, check the two very well. Just use the principle again. Are you done? Nice one. Is it nice? Okay, nice one. Remaining this one now, complete it. Are you done? But you get it. But you understand? Because you must understand it. Is it right? Alright, let's continue. Hello. So in your book, you know I used to do it in secondary school. Write down now. Write correction. Look at this. What antigen? Hello. Anyhow you are doing it, just like I said, you can put the recipe in here, you can put donor here, no problem. But in the donor, always check for the antigen, and in the recipient, always check for the antibody. Now, what antigen do we have here? Antigen A, right? What antibody do we have here? No antibody. Eh? Says what? What antibody do we have here? Hey. What antigen do we have here? So what are you saying now? No antibody. So no antibody here, right? Because we have antigen A and antigen B. So this one cannot have any antibody. Where is it? This one cannot have any antibody. Good. So since there is no antibody, no fighter, they don't get anybody to fight for them. So whether antigen A is here, this one have no antibody, right? Plus or minus? Because there is nothing to fight. What antigen is here? Antigen B, right? What antibody? Nothing to fight. I they pity them like they have nobody to fight for them. What antigen do we have here? Antigen A and B, right? What antibody do we have here? No antibody to fight. So positive. What antigen do we have here? No antigen. What antibody do we have here? Now them match pass. No antigen, no antibody. Plus or minus? Good. Now in this one, what antibody do we have here? Sorry, what antigen do we have here? Antigen A, right? What antibody do we have here? Like them balance. Antibody A and antibody B. Anybody will come. So antigen A, this one have antibody A and antibody B, right? Plus or minus? Triangle. This one have antibody A and antibody B, meaning the antibody A can fight against the antigen A. Is it not? So minus. What antigen do we have here? Antigen B, right? What antibody here? Antibody A and antibody B. Can B fight to B? Plus or minus? Good. What antigen do we have here? What antibody do we have here? The type of war that will take place here. A will be fighting A. B will be fighting B. Plus or minus? What antigen do we have here? No antigen. What antibody do we have here? A and B. Can antibody A and B fight against no antigen? Plus or minus? Good. Now if you check very well, you will see that here all of them are positive, right? While here all of them are what? Positive also. Now these are the donors, right? Why these are the... So we conclude that blood group O, they are the universal what? Donors, meaning they can give to everybody. Universal donor. And we conclude that antibody AB, they are the universal what? Recipient. So you can write it down. That the universal donor is is blood group O. The universal donor is blood group O. Universal donor is blood group O. Why the universal recipient is blood group AB. I the universal recipient is blood group AB. Are we okay with that? It will come. I didn't say may come. It will come. It will come. Don't cram it. Plus, minus, minus, plus. Plus, minus, minus, plus. Plus. Understand the principle and know what you're doing. It's actually very simple. And the that's that. Any question on this? Any question on this? No question. No question. Good. Okay, let me ask. You know, somebody of blood group B cannot receive blood from somebody of blood group A, right? Is it not? Let's assume I'm blood group A, and let's assume he is blood group B. If I receive blood from him, what will happen to me? Who tell you I will die? What will happen? There is a term we use. Agglutination, right? Or clumping of blood. That fight I was using since they will fight against this. It's not that the antibody is carrying machetes. Once it sees, no, it's not like that. Agglutination will take place. Clumping. Blood will clump together like this. Blood is preventing blood flow. So as clumping takes place like this, there is a problem now. Blood cannot be distributed again. Vital organs will be deficient of blood. The person finally will do what? Will go to the other side. Yes. Oh, we are coming to rhesus factor. We are coming to rhesus factor. All right, but do we understand this one? Good. Any question? No question, right? Can we move on now? All right. So the universal recipient is what? The universal recipient is what? Universal recipient. So why is it A and B? A, B, right? Why the universal donor is what? Good. There's no need to give you notes on all this. A can receive blood from, because you already get from there. Good. Rhesus factor. Somebody. Rhesus factor. Rhesus factor is a protein found on the red blood cell. Rhesus factor is a protein found on the red blood cell. Is a protein found on the red blood cell. If present, the person is said to be rhesus positive. If present, the person is said to be rhesus positive. If absent, the person is said to be rhesus negative. The person is said to be rhesus negative. If absent, the person is said to be rhesus negative. Rhesus factor, you can just be writing ROH factor. Rhesus factor plays a crucial role. Rhesus factor plays a crucial role in blood transfusion and pregnancy. In blood transfusion and pregnancy. Rhesus factor plays a crucial role in blood transfusion and pregnancy. Are we there? Okay, not too much notes, just listen up. Normally I don't like giving too much notes, but put it in your head. All right, so we said if you forget everything we've said today, don't forget anything we've said. Don't forget that medical genetics is a branch of genetics that deals with what? Diagnosis and management of hereditary disorders, right? Good. And we mentioned 3 things that can cause genetic disorders. Number 1, we said. Number 2. Number 3. And we've done polymorphism. And we said polymorphism is a variation between normally healthy individuals. And we said an example of that is what? ABO blood grouping system. ABO blood grouping system. Good. Now, the rhesus factor, we said antigen is a protein on the red blood cell, right? Rhesus factor is also a protein on the red blood cell. And it becomes a concern during blood transfusion and in pregnancy. And in pregnancy. So, if you are pregnant in this class, you have to go and somebody should volunteer, will not harm the baby. Let's check something. Rhesus factor is a point of concern, become a concern when blood transfusion wants to take place or in pregnancy. Now let me explain. We said it's a protein on the red blood cell. Not everybody has it. If you have the protein, if you have this rhesus factor, this protein on your red blood cell, this antigen on your red blood cell is also called antigen. This antigen on your red blood cell, if you have this rhesus factor, we said you are rhesus what? Positive, right? If you don't have, you are rhesus what? Good. We'll look at the blood transfusion chart again, and by now I believe everybody can do that chart. So we'll look at it again, but now we'll relate it to rhesus factor. Do we get? So we relate it to blood transfusion and we relate it to pregnancy, the rhesus factor. Now, if you are asked, I remember there was a time, I think the COVID-19 period, there was something they were doing in their department, and they said everybody should send their blood group. And me, I sent my blood group A, and they sent it back. A what? At that time, I go check my green card. A what? Whether A plus or A minus. I discovered I'm A something. Now, it's either you are A positive or A negative. If you say what is your blood group is O negative or O positive, not just blood group O. Blood group O what? Blood group AB what? Plus or minus. Do we get? So if I say I am blood group A positive, it means I'm of blood group A and I have the antigen, right? The rhesus factor. If I'm blood group A negative, it means I don't have, right? I don't have the rhesus factor, is it not? Good. Okay, before we relate it to blood transfusion chart, let me start with pregnancy. In pregnancy, let's assume this is a pregnant woman. And the pregnant woman is rhesus negative. Is rhesus negative. And the developing embryo, the baby developing, is rhesus positive. Now look at this case. The mother, don't ask me where the child, the word has spoiled. Your mother don't have it. Where are you getting it from? Alright, so we can get into where the child gets it from, but I don't want to go into that yet. The pregnant woman does not have the rhesus factor. So the mother's immune system does not know that protein. Do you understand? The mother does not have it. The immune system does not recognize this protein. Does not recognize it. Now the child is developing, and the child is now developing with that rhesus factor. The mother's immune system will now see foreign substance. We now consider that rhesus factor developing on that child now, in that child's red blood cell, as a threat, as dangerous. So the mother's immune system will start to fight against that embryo. Remember, the immune system is to fight, right? Protect. So since the mother does not have that rhesus factor, it's rhesus negative, the immune system now, seeing the embryo carrying the protein, and the protein becomes a foreign substance, becomes a threat to the mother. So the mother's immune system will now fight against the embryo. This can lead to miscarriage or complications in pregnancy. Poor baby. Now, what if a case of the mother is rhesus positive and the child is rhesus negative? What do you think will happen? Now, look at this. So, the mother have the protein, right? That's why we say it's rhesus positive, is it not? Have the protein. Now, the embryo does not have. Don't you think that the developing embryo will not recognize this and will start to fight against the mother and kill the mother? Then he will not be born. The child's immune system cannot do that. The world has spoiled, but they still respect the womb. All right, so the fetus immune system cannot fight against the mother. Said the fetus will not be asking the mom, where do you get this thing from when I don't have it? It's not possible. Do you get that? So it's not a threat. What if they are both rhesus positive? Is there a problem? What if they are both rhesus negative? Nothing will happen, right? Please understand this, because question will also come from rhesus factor. If you understand it, no matter how they twist the question, you'll be able to answer. But if you cram it, forget it. In fact, if you cram other course and it works, this one you cannot cram and pass. I always say, don't read to pass exam. Because if you read to pass exam, you might fail exam. Read to understand. Even if you not use it after exam. Alright, so that's that. Now let's look at rhesus factor and how it applies to blood transfusion. Have you written something done in pregnancy? Should I give you notes? Right. In pregnancy, if the pregnant woman, if the pregnant woman is rhesus negative, in brackets, that is, does not have the rhesus factor, that is, does not have the rhesus factor, close the brackets, and the developing embryo, that is the fetus now, and the developing embryo is rhesus positive, in bracket, that is, have the rhesus factor, close the bracket. The mother's immune system will consider the rhesus factor on the developing embryo, as a threat. Are we there? As a threat. And so we fight against the developing embryo. And so we fight against the developing embryo. Full stop. This may lead to miscarriage or complications in pregnancy. Are we there? This may lead to miscarriage or complications in pregnancy. Now let's relate this to blood transfusion. This rhesus factor of 18. Let's relate it to blood transfusion. So basically we are going to be, let's say this is our donor and this is our recipient. So we are going to use the foundation we already laid on blood transfusion. In the donor, what are we looking at? Is it antigen or antibody? And in the recipient, we look at the what? Antibody, right? Good. Now, I'll give you time to write. Please just listen up. Somebody of blood group A negative. I think this person have the rhesus factor, right? Does not. So anything I say now, you say yes. So this person does not have the rhesus factor, right? Good. Can this person donate blood to this person? Now let's look at this. Forget about the rhesus factor now. Can A donate blood to A? Yes. What antigen do we have here? Antigen A, right? What antibody do we have here? Antibody B, right? Antibody B. So antibody B cannot fight against antigen A. So normally it's supposed to be positive, right? It's supposed to be. Now, this one does not have the rhesus factor, right? This one does not have the rhesus factor. There is no problem. Do we get? Now, A plus and A minus. This is the donor. This is the recipient. The person receiving, does he have, no, it's a she. Does she have the rhesus factor? The person donating, does he have? Is this plus or minus? Hey, is this plus or minus? If you say minus, let me see your hand. 1, 2, 3, 4, 5, 6. Hands down. If you say, I don't know.
They have
this exam period.
Okay, the only this exam period.
Yes.
I wanted you to help us for marking of manual. When I said I should go and tell you, I said, don't know.
Marking of manual. This exam period will not work. Even Sundays I teach.
Okay, Sunday teach.
But if it is after they are done with exam,
okay,
I can do that.
Exam.
Yes.
Exam will finish 7th of
next month.
Next month. Oh,
after exam.
You will be visiting after the exam.
Yes.
Okay, I will tell the madam that after the exam.
Yes, after exam I'll be free.
Okay. Thank you.
Alright. Alright, so somebody of blood group A positive. This is donor, right? This person has the rhesus factor. But normally, can A receive blood from A? Yes, right? It's supposed to be positive. But here, is there a rhesus factor?
Yes.
Here is the person receiving, is there a rhesus factor? Plus or minus? Minus, right? Because this person receiving now does not have this protein. So if it comes in, the immune system now, there's a problem. Oh. Do we get? Now, this one now, plus or minus? Because originally, A cannot receive blood from B, right? Minus, plus or minus? Plus or minus? They are carried away by the minus, right? I'll just minus your score now. Alright, so now, A, B have what antigen? Antigen. What antibody here? Antibody B can fight, right? Hey, it's minus now. Why were you saying plus? Plus or minus? Plus or minus? What antigen do we have here? No antigen, right? What antibody do we have here? Can antibody B fight against no antigen? So normally it's supposed to be plus, right? But now let's look at the rhesus factor. Yeah, is there a rhesus factor? Is there a rhesus factor? Plus or minus? Good. Now look at this one. It's supposed to be plus, right? But what is there a rhesus factor here? Is there a rhesus factor here? So when the rhesus factor comes into this person, there'll be war. Right? Because this person does not have it. So the immune system will start to fight against this innocent guy here. Do you understand? So yeah, is it plus or minus? Plus or minus? I hear that plus again. Alright, so next one now. This is this plus or minus? Plus or minus? If it's plus, let me see your hand. 3 persons. If it is minus, let me see your hand. If it's minus, let me see your hand. Please be bold. If you are getting it, get it boldly. If you want to fail boldly. If it's plus, let me see your hand. Hands down. If it's minus, let me see your hand. If you don't even know what we are talking about, let me see. You will get it now. Normally, hello, I don't believe in I will understand later. Understand now. Normally, can A donate blood to A? Yes, right? But now, this one, there is a protein, right? Yeah, there is no protein. This one is the one donating. This one is the one receiving. So, and the one donating does not have the protein. This one have. Is there a problem? There is no problem. There is no problem because this one have it. This one does not have. So, as you're receiving, it does not have. So, there is no problem. Even if it has, there is no problem because your immune system will recognize it. Do you understand? This one plus or minus? Una don come again o. Plus, good. Plus or minus? Why? This one have it, right? This one does not have it. Do we get? Plus or minus? Because this one have it, the donor have the protein, the person receiving have the protein. Now we. Do you understand? Now I'll do this one as the last line and you complete the rest for me as your second CA. Yeah, plus or minus? Plus or minus? A and B, once you see A and B now, you should not even check the rhesus factor again. Plus or minus? Plus or minus? Plus or minus? Because this one does not have, the person donating has. So if this one, if it's receiving blood now, this rhesus factor is foreign. So the immune system will react. Yeah, plus or minus? Plus or minus? Minus, right? Plus or minus? Plus or minus? Plus or minus? Okay, so complete the rest for me. If you are done, call my attention. All right. You the mind. I dey teach you the mind. All right, so let's do this together. Now, B and A, you know, is negative, right? Yeah, plus or minus? Minus, right? Plus or minus? Plus or minus? So this positive, so it can receive from this person, right? So what? Positive, right? Plus or minus? Plus, right? B plus, the same now. Plus or minus? Plus or minus? Plus or minus? Plus or minus? Eh? Some person is only this I'm hearing. Now look at this. This is B positive. What antibody do we have here? What antibody? What antigen do we have here? No antigen, right? So no antibody to even fight in the first place. There is rhesus factor here, there is rhesus factor here. So plus or minus? Yeah, plus or minus. This is where most person, okay, yes, yeah, most person got it wrong. Plus or minus? What antigen do we have here? What antibody do we have here? No antibody, right? And they both lack the rhesus factor. So plus or minus? Plus or minus? Because this one have the rhesus factor and this one does not have. Do we get? Sister is not following. Let me take it again. Normally this antigen A, right? This antigen A, is it not? What antibody do we have here? No antibody. So no antibody can fight against antigen A because there's no antibody here. But the fact here is, here we have rhesus factor here, and this one person receiving does not have the protein. So if this person receive blood from this person that have the protein, there will be a problem. Do we get? So here we said it cannot go. Plus or minus here? Plus or minus? Both of them lack, so plus. Plus or minus? Plus or minus? Plus or minus? This one does not have, but this one have the protein. This one have the protein. So there will be a problem if he receives. So plus or minus? Yeah, plus or minus? Plus. Plus or minus? Because this one have and this one does not have. Now, yeah, plus or minus? Plus or minus? Some persons are just saying plus, but we don't know why we are saying plus. Now, why we are saying plus here is this. Here we have, of course, we know that AB, they are the general recipient, right? They can receive from everybody. Good 18, this other AB here have the rhesus factor. So whether the person have or not, there's no problem. So this now plus or minus? Minus here. Because that one have and this one does not have. Plus or minus? Yeah. Plus. Good. Now at this point, the universal donor is what? So you can see that from this chart, the universal donor, though before we just said the universal donor is O. But the universal donor now is what? O. O what? Negative. O positive, they are not the universal donor. There are some persons they cannot donate to. So O negative is the universal what? While AB what? Positive are the universal what? So write it down. After this chart, write it down. O negative are the universal donor. O negative is the universal donor. While AB positive. While AB positive is the universal recipient. Did you do this in class? You know one? You did it practical. Which practical did you do? Blood transfusion. How can you transfuse blood? You check genotype. Are we done with this? In exam, you not do practical. You write it down for them. Are we done with this? Have you written that AB minus AB plus is the universal recipient, O negative is the universal donor? Have you written that? So all this, have you written this down? Can we continue? Can we continue? Mutation.
Please click on the subscribe button and subscribe to this channel. Feel free to go and watch other videos related to your course, and do well to drop your questions in the comment section. Now, if you watched to the end, drop in the comment section, I made it. Just drop in the comment section, I made it.